Hello and welcome to Healthy Minutes. We're here to discuss your health needs and concerns today with Dr. Nicholas Camboris. Good morning, doctor.
Good morning, good afternoon, and good evening. We have been going over a lot of information since we were together last time. And what we'd like to do today is clarify what is it that creates the best environment for a healthy body. And in order to understand that, we want to take it and break it down all the way to the level of the cell.
Great. I have some great questions to ask about that.
It's so important to understand that basic level because that is the way that you can find the optimum route of experiencing the most health and most benefit out of a particular treatment plan, whether it's at home or in an office. So we've got two main things to discuss regarding a healthy environment for the body, which is chiropractic care,
right,
and how that works and how it improves the system. And secondly, the environment that you set it in with the food that you eat. And why are we going to go into that venue is because the food that you eat is creating the environment of you are what you eat.
That's very true.
And your cells are going to work based on the tools that you're providing it. So one of the most important things to understand when looking at the level of the cell is how does it communicate with each other?
Absolutely.
So a question you may have would be, how does one cell communicate with the next?
Yes.
And the way that it does that is by a chemical interaction.
Okay.
One cell will communicate with the next in order for it to be able to survive and live in a homeostatic environment is through a chemical reaction. And the chemical reactions which occur are based on the environment that it's in. So for example, if you're malnourishing your body through the absence of healthy food or crowding it with unhealthy food, or for example, providing a chemical environment that's unhealthy through high levels of stress.
Right.
Because your body creates its own hormones, its own chemicals. And if you're not allowing your body to rest because of high stress or lack of sleep, and a multitude of other examples, it will not provide the appropriate chemical environment for that cell to communicate with the next. Now, the body is an incredible thing.
It is.
And what it does is it will use whatever is available in order for it to be able to survive. And the body is able to survive in an environment that can be very toxic for quite a long time. But it eventually catches up to you, and through that process, patients experience symptoms. So some examples of symptoms that most commonly introduce a patient into a chiropractic environment.
Right. Most people think it's just for back pain. And while that is one reason that people come in for chiropractic care, what are some other things that it's good for?
Well, chiropractic care, most oftenly a great motivator is pain. So
right.
Whether it's for neck pain, back pain, headaches, knee pain, sprained ankles, frozen shoulders, carpal tunnel syndrome, these are the very common things of why a patient might seek out chiropractic treatment.
Mm-hmm.
But really, my favorite patient is the patient that comes into the door saying, I feel great, help keep me that way. Because
right.
That's the point. That is the reason why you really want to take care of your body is not to just cover up a symptom or to treat a particular crisis. You want to help prevent those things. That's the smartest way is preventative medicine.
Well, how does chiropractic do that then? How does chiropractic keep your body healthy?
Excellent question. So remember, we talked about one cell communicating with the next through chemical interactions.
Right.
Well, through chiropractic care, let's understand where those chemicals come from. They're secreted by glands.
Okay.
Glands secrete the chemicals necessary for your cell to communicate with the next. And these glands, they are controlled by the master system of the body, which is the nervous system.
Okay.
So you have a signal from the brain that travels through the spinal cord, through the spinal nerves, and into the peripheral nervous system. That's the group of nerves that travel through the body. And they interact with these glands. And the glands then secrete the chemicals that are used by the cells in order to have a discussion. And it's like a dance.
Right.
So if there's an interference in that communication pathway from the brain to the cell, it doesn't work well. And the pathological term for an interference, physical interference at the level of the joint on the spinal column, has a very important term, and that term is called a subluxation.
It's a big word.
It is a big word, and it's an important word because that is exactly what chiropractors treat, are subluxations. And a subluxation is the misalignment of a bone that shifts and puts stress on a nerve. And I'm not talking about inches of shift. We're talking about very small measurements of misalignment
Right.
that will put either direct pressure or hydraulic pressure or tissue pressure on a nerve. And that pressure irritates that nerve and makes it become either hyper or hypoactive.
Okay.
So it
what's the
either works
difference
too
there?
much and causes things like muscle spasms and pain, or it doesn't work enough and you end
Okay.
up having muscular atrophy or weakness or hesitation in joint movement.
Okay.
You can have a reduction in the ability for an organ to work.
That's not
Really? For example, a gallbladder isn't working like it should.
right.
There may be too much pressure on the nerve. And if you think that's too far-fetched out there, ask the patient that's been treated for spinal subluxations and things start working again, like IBS no longer exists. Because it happens.
Wow.
Migraine headaches go away because it happens.
Mm-hmm.
And it's controlled at the level of the spinal column. Patients have had chronic coughing issues because the diaphragm was spasmed. The important nerve, the phrenic nerve, which comes from the spinal column, is irritated because of that subluxation. When that subluxation is removed through the miracle of chiropractic manipulation. And I really call it that because it really feels miraculous.
Well, it sounds like it can help with anything. Internal organs, the pain that you talked about.
It will help with anything. The question is whether it's enough to make a difference.
Okay.
Because if you still have high stress levels, you're still eating poor food, you're still practicing poor posture, you're still not exercising, you're still not doing the other things that are necessary in order to create a healthy environment, chiropractic manipulation is not enough. That's where these other avenues of medicine help, through either physical rehabilitation or physical therapy, nutritional counseling, medical intervention. You know, if you're sitting on the table talking about back pain and radiating pain into your arm, and through blood pressure tests, we find out that it's not at a healthy level and it's at an urgent level. That patient needs urgent care and needs to get on the
Right.
appropriate medicine to level out that blood pressure. But if that same patient now who has taken that medicine to reduce their pressure still doesn't practice a healthy exercise plan and good eating habits, or reduced stress levels, or things to help to improve their sleep patterns, that medication is only a temporary fix. The goal is to get off the medication.
Right.
And in order to do that, you have to practice the other healthy methods.
So for chiropractic to work at the best of its ability, patient has a lot of work to do too.
Yes, it does. The patient does have a lot of important work to do in order to be able to create that healthy environment. So we have a signal now that comes from the brain, travels through the spinal column via the spinal nerve, and now has freed up that interference at the level of the spinal joint. That nerve can begin to work properly.
Right.
So you've just created a healthy environment, and that signal is not interrupted and can appropriately communicate with the gland to release the appropriate amount of chemicals.
And now your cells communicate better.
Exactly.
Great. Makes sense. Now, say I'm a new patient and I come in now and I'm hurting. Can you make it go away in one adjustment? Does chiropractic care work that way?
That is an excellent question because it comes up so often. When you're visiting to see your chiropractor, the most important thing is to have the right information in order to have an appropriate diagnosis. And once we can gather that information and provide an appropriate diagnosis, just like you would go with any other physician, sometimes it's important to have other tests involved that aren't provided right away, whether it's blood work or MRIs or CAT scans,
Right.
X-rays, and those things need to be evaluated. And most of the time when a patient comes into the office, they've been dealing with symptoms for not just days or weeks or months, but years.
Right.
It's very difficult to take something that chronic and treat it in one day and expect to have complete resolution of the condition. So it does take time, and a chiropractor should be used to get the process started and moving that patient in the right direction, which may take weeks or months, dependent upon many other factors that are evaluated. But the fact is human tissue works a certain way.
Right.
And we've got a neat chart here based on human tissue that helps to describe the method at which a treatment plan is provided for a patient in an appropriate manner.
Okay.
As I mentioned, the most common method a patient will visit a chiropractic office for care is because they're in pain. And almost always that pain is there because there is stress on a nerve.
Okay. Right.
That impingement on a nerve creates a lot of discomfort. And quite frankly, it doesn't take very long to get somebody out of a pain cycle. Every patient goes through 3 phases of care. We call it relief phase of treatment, getting them relief, and then working on correcting the problem, and then strengthening it so it stays that way. Getting somebody out of pain is different for every patient based on age and other complicating factors, whether it's arthritic, stenotic, osteoporotic, or whether it's just a young person who is overall relatively healthy but had an injury.
Well, I've often heard you use the phrase, took 30 years to get this way. It's not going to stop hurting overnight. So it makes a lot of sense.
This phase here can happen in a few days or it can happen in a few weeks. It usually doesn't take months to get somebody out of pain.
Right.
Now, you might be asking yourself, but I've been dealing with pain for years. How in the world can that happen that quickly? You'd be amazed. Not every patient will get out of pain or is appropriate for chiropractic care. That's the purpose of the initial evaluation.
Right.
So a patient is taken out of all or most of their pain.
And
now it's time to start correcting that.
Okay.
A little bit of pressure off the nerve creates a major change in how you feel.
It does.
Now we need to work on the underlying subluxation and correct it so that they can stay that way. And correcting a patient's problem typically means providing them with a home exercise plan, providing them with something called home traction therapy. It's not appropriate in all instances, but in many cases it is, because poor posture and poor alignment and a weak spine is very common. And there are dozens of different kinds of traction protocol. It's dependent upon what is diagnosed on that initial evaluation. Then we progress the patient through correcting phase and strengthening, building an exercise plan in office so that we can allow that patient to become independent. And you've got to do the work, you've got to do the homework on your own. If you don't do that, it just doesn't work because gravity never goes away. It's always pushing down on our body, and we've got to fight against it.
Yep.
And yoga and Pilates and running or a strengthening power plan at a gym, all of those things are good.
Okay.
If you're having pain or a problem, you've got to evaluate it appropriately, because what you don't want to do is make the mistake of strengthening an unhealthy joint. That is where a mistake is made most often.
Well, you're holding it out of place, so the muscles are trained to hold it out of place then.
Exactly. Remember we mentioned that the body can deal with a lot of distress and hide things from you for a real long time?
Yeah.
You can take an unhealthy joint and strengthen it and begin to feel better, because strengthening an unhealthy joint is better than leaving it alone and being in pain.
Right.
But when you take a joint and you allow it to become healthy by providing it flexibility, range of motion, agility, endurance, you begin to stabilize that joint and then strengthen it so that it can allow the most amount of space for that nerve to be comfortable and flow through.
Okay.
Once you begin to strengthen that healthy joint, you can allow it to stay that way for a very long time. And that is the goal, to help patients become as independent as possible. And again, as mentioned, the one thing that never goes away is gravity. And most patients are not dedicated enough to live the optimum health plan. In those instances, patients who are that healthy and aware understand that chiropractic care is an important part of their life, just as, if not more important, than seeing a dentist for the rest of your life. You know, you can go to a dentist twice a year to keep your mouth clean, but if you're not flossing and brushing, it doesn't work. You're going to show up with cavities. But if you're doing your part at home, you can go and visit your dentist and have a nice clean mouth all the time. But there's still some benefits that you need somebody else's hands to do for you.
Right.
Same goes for your spinal joints. We're trying to keep your spine clean. And those patients typically see me 3 or 4 times a year. Most patients need help about once a month because they're not quite as dedicated. They sit in chairs for 8 hours a day, or they're standing on hard surfaces for 8 hours a day, or they've got stress. Stress is an important part of understanding how to take care of your body.
Now, if I've done all 3 of those phases and you've gotten me out of pain, why should I be getting those maintenance adjustments once a month? I'm all better, aren't I?
That's right, you are better, and that's the reason. You want to stay better.
Okay.
Maintenance adjustments, what that means is it means that we're taking a subluxation before it has become chronic and before it gets to the level of pain. Again, the body can deal with things so much. Once you're at the level of pain, or once you see arthritic conditions on an x-ray, it's been there for quite a long time. Patients that have had x-rays and have gone to their doctor or the emergency room, and they throw the x-ray film up and say, well, here's the problem, you're getting old, you got to just deal with it. Here's some painkillers and take that, and it's just what you have to, it's just part of life. That's not a good answer. It's not an answer I'd want to hear.
No.
And the reason I say it's not a good answer is because unless you have a genetic disposition, you have many other answers. It's just that that answer isn't as easy as a pill. You got to work on it. And if your level of diagnosis is so severe, it doesn't mean that nothing can be done for you. It just means you have a lot of work in front of you, and we got to take baby steps to get you to the point of optimum health.
Okay.
Patients have had back surgeries and have been on multiple medications, have sinus conditions, have IBS, have sciatic conditions, and all of these things. Can they all be treated under chiropractic care? All subluxations can be treated under chiropractic care, and the great side effect is you begin to see these other conditions diminish or go away. And when you throw in a healthy environment by the way that you eat, it's just the best thing at creating a healthy environment for these cells to communicate together.
And what else is great about chiropractic care is, you talked about symptoms earlier. You're not treating the symptom with chiropractic care. You're treating the underlying problem that's causing the symptoms. So everything that your body wants to heal itself, and that's what chiropractic care helps it do. It's great.
That's what we're trying to get to click. That's exactly right. It's the underlying problem that we're treating. And it's a completely safe, based on hundreds of thousands of clinical trials, and millions of patients a year are under chiropractic care. And if a health professional, a medical health professional, may tell you that you shouldn't see a chiropractor, it's the same bad advice if you went to your chiropractor and said, don't have surgery. I'm not a surgeon. It's not my place to tell you not to have surgery.
Right.
They're not a chiropractor. It's not their place to tell you don't see a chiropractor. they have never manipulated a patient in their life.
Right.
Why would their opinion of chiropractic care be important? I've never surgically repaired a patient in my life. Why would that opinion be important to that patient? But if I thought a condition can be resolved under chiropractic treatment and all these other alternative therapies, that's the advice that I'm going to provide. And if I think I can't, I'm going to provide them with the appropriate referral so they can have some different advice for intervention.
Right. Okay. Now, back to this chart. I see this line goes up and then it dips back down. So we talked about the relief phase, about getting the pressure off the nerve, and then we talked about the correction and strengthening with the home exercises and everything. Why does the line on the chart dip back down there?
Let me help to explain. You have that model there next to you.
Absolutely.
Perhaps if I used some general anatomy, it might help to understand.
Okay.
This is a plastic replica of a spinal column and the spinal nerves.
Okay.
And your tummy would be here and your back is here. And the bones that we have here, these are what we call the vertebrae. And these plastic pads in between, those are the discs of the spine. These are the nerves that come off of the spinal cord.
Okay.
And what happens with time or with trauma? A joint will begin to shift out of its normal position and it will put stress on that nerve.
Right.
This is what we call subluxation.
Okay.
In the initial phases of treatment, when we're working on correcting these subluxations, remember there is not only stress on the nerve, but in order for a bone to move out of its position, for example, poor posture, when gravity pushes down axially, directly down onto the spine, there are weak points in the spine. Then the spine will begin to kink in different directions. And where that weak spot is and where those kinks are, those are the subluxated joints.
Okay.
So the ligaments and other soft tissue structures that hold these joints together are also under distress, and they're also inflamed. And through the process of healing, patients can go through phases of feeling a little better and a little worse, kind of like when you first start an exercise plan.
Okay.
You can get sore in the beginning, and as time goes on, as you make the treatment plan a little more aggressive and you get a little stronger and you're working your muscles a little harder, you can get a little sore again, and you go through these phases. It's a short phase. Remember, it's days to weeks that you go through that. And then as your body becomes accustomed and its endurance and its flexibility and agility is improving, that begins to diminish and you're experiencing an asymptomatic phase through your correction and strengthening.
Okay.
Does that make sense?
Yeah, absolutely.
Now, once you correct these subluxations, are they corrected forever? No, they're not. And so does that mean that you're going to see your chiropractor forever? Doesn't mean that you have to, but you should.
But you should.
Exactly. Whether it's a chiropractor that you've been seeing for a problem or any other chiropractor, or quite frankly, there are osteopaths that also do manipulation of the spine. It's important to have these joints adjusted periodically.
Now, what's the best time to get treated with chiropractic care?
The best time to be treated with chiropractic
That
care,
back.
thank you, is quite frankly at birth. And I know
Really?
that's a strong comment.
So it's safe for kids then?
It is extremely safe for kids. And let me explain this. Before you think I'm talking in left field, the best time to get an adjustment is when you're asymptomatic. But babies go through birth trauma, every single one of them. And the style of manipulation that has been designed for infants is very different than for an adult. And the reason why you want to have that child adjusted is for the same reason why any other thing with a spine should be adjusted. You want to take stress off the nerve. You have a colicky baby, chances are they need an adjustment. Well, maybe they're just not, maybe they're having gas. There's a reason why they're not experiencing a healthy digestive peristalsis and they have gas. Can it be coming from the formula? Can it be coming from the lack of providing a mother's milk? Can it be coming from a stressful sleeping environment? It can be coming from a lot of things. That's the reason that you consult with a health professional. But babies need their adjustments, and I've adjusted dozens and dozens and dozens of babies from 2 hours old, premature,
Oh, wow.
3 pounds, that was my own son,
Oh, yeah, that's right.
to babies that are 18 hours old, 2 days old, 2 weeks old, and children that are 2 years old, 3 years old, all the way up through until you're in your 90s.
So chiropractic care is good for almost everybody.
It is essential for everybody.
That's, I mean, it sounds like everybody should be seeing their chiropractor this week.
Yes, they should. And when you have questions about seeing your chiropractor, do your due diligence and do your research, because
Yeah.
there is so much out there.
There's a lot.
And ask the questions, but most importantly, have your consultation, do your examination, and see for yourself if it's right for you and your family.
I think that's a great idea for everybody. And it looks like that's about all the time we have today, Doctor. It's a really great talk about the point of chiropractic care and how it can help everybody with any problems they could be having. So I wanted to thank you for being here today.
Absolutely. And remember to do your part at home too. It doesn't end with your chiropractor. That's just the beginning. You have to do your part in order to maintain that healthy environment and that healthy lifestyle.
All right.
Thank you.
Thanks.